my name is Dr. Phyllis Supino. I am Director of Clinical Research and Epidemiological Research at SUNY Downstate Medical Center in Brooklyn, New York. And the topic of my talk was temporal trends in valvular heart disease. It's a retrospective study of a 30-year period. Essentially, there's been very little known about temporal trends in valvular heart disease. Most of the studies that have been reported in the literature are cross-sectional studies of prevalence. Some of them are based on small echocardiographic series. Some of them, the more recent ones, are actually large population-based studies. But with very few exceptions, all studies are cross-sectional. We began a number of years ago a study of valvular heart diseases in the hospitals of New York State. We utilized data from, the acronym for the data source is SPARCS, which is a data source that is sponsored by the New York State Department of Health, and it comprises information from hospital discharges for over 200 hospitals in New York State, and that represents over 57 counties in New York State. So what we did was to evaluate the number of hospitalizations among patients with a diagnosis, primary or secondary, of valvular heart disease. We also sought to determine the surgery that were performed, or the volume of surgeries for these patients. And we also attempted to determine independent risk factors for death in the hospital and also for death after surgery. This year, we expanded our analysis to include up through 2012, and that begins in 1983, when data were first considered to be reliable, all the way up to 2012, so that's a 30-year period. We found, by looking through these large computer-based records, almost 3 million patients or cases of valvular heart disease in the hospital. Enormous. The number of cases of patients with valvular disease increased steadily over time from 1983 to 2012 and essentially quadrupled. During that same period of time, the number of hospitalizations for all causes actually decreased. Hospitalizations for valve disease were associated with the increasing age of the population, as has been found in other studies. We found increases in the incidence of hospitalizations for valve diseases among all forms of valve disease: aortic, mitral, aortic and mitral, tricuspid, or pulmonic. The largest number of cases were those of mitral valve disease. There were over 160,000 operations for valve operations in the hospital during this period, and most of those were valve replacements. There were a very large number of deaths in the hospital among patients with valve disease. These death rates did trend down a bit over time, but they were on average about over 4% a year, or closer to 5% a year. What predicted deaths in the hospital were being a male, unfortunately, age over 65 years, the presence of heart failure, and the requirement to undergo valve surgery. Among the patients who were operated, there were similar risk factors for death in the hospital, but they tended to occur more among women versus men in the surgical series, and this is consistent with other reports. There are limitations from using SPARCS data. It is difficult to know how much of these increases are true increases in the amount of disease in the population, or whether these increases are due to better recognition. But we believe that they are true increases in the population. Certainly the surgeries would suggest that that is the case. The findings tell us that there needs to be far more attention given to valvular heart disease and that more resources ought to be directed towards finding remedies to prevent it and then treat it appropriately.